Assalamu alaikum everyone, we are back with another exciting video. Last time Dear Doctor was Dear Doctor, and this time Dear Doctor would be kind of a stressful or kind of patient carer, and I would try to mimic a role of doctor with you, though I'm not an official one, but I'll try to scale up my language so that you could understand how can you be a dummy doctor.
Yeah.
Yep. Alright, so fine, shall we start?
Yeah, of course.
Good to go?
Yeah.
So yeah, here my timer is ready. Good morning, who's there?
Yes, I'm Munir.
Okay, Munir, I need to know some basic information from you. First of all, may I know how old are you?
I am 45 years old, doctor.
45 years old.
Yeah.
Okay, to me you seems to be stressed. What happened?
Yeah, of course, doctor. Actually, I run a business, consultancy business.
It's a very good business, by the way.
Yeah, I work 12 hours a day. And
How many hours?
12 hours a day.
12 hours.
Yeah,
okay.
of course. I didn't have any problem since 1 month ago.
Okay.
But in these days, actually, my grandmother,
Yeah.
he is suffering and diagnosed with Alzheimer's disease, as you may better know, sir.
Yeah.
And he is just I don't know how to manage his condition.
Okay.
And in these days it's about 2 weeks that I am having trouble with my sleepings. So
Okay.
I can't sleep well. I'm just here to for you to give me some sleeping pills.
I take my notes, thank you very much. I need to know some longitudinal analysis of your sleeping patterns. So you mentioned before 1 month things were fine.
Yeah, okay.
So how
I was happy.
how long you had been sleeping?
It's about 3 weeks. Yeah.
Okay. But before that, how much sleep did you get a day?
I was sleep at 10 p.m. and wake up in the 6 in the morning.
So that was quite fine. You were
Yeah.
sleeping for 8 hours.
Yeah, of course.
Okay.
But in
now,
these nights, I just sleep for about 40 to 3 hours. 3 to 4 hours.
sad to hear
I
that,
do.
sir. 4 to 3 hours.
If you just give me sleeping pills, I will manage it.
It's good to suggest something, but I guess I'm in better position to suggest for now. If I would suggest you sleeping pills so early in just some basic stress management, I guess you would be becoming accustomed to that, or you would be more, addicted to that, which would not be a good idea for now, I guess. In my opinion, I guess we have more remedies to suggest. What do you say?
Sir, the doctor, I have to say that I'm not that type of person which can be addicted to this type of drugs. So I'm sure I will manage it. Just give me drugs.
Do you smoke or something?
Sometime occasionally, yeah. Whenever when I'm with my friends, I do.
What about alcohol?
No, I don't. Alcohol.
Never consume alcohol at
No,
all?
No.
All right. What about your exercise? Do you go for some exercise?
Maybe it's twice a week for a short term running.
All right. Okay. So you're not a regular runner?
No.
Okay, sir. If I would be giving you sleeping pills for now, you seem quite young to me. 45 years is not that ripe age in which you have no other option. Okay. For example, exercising can be a good option for you, as well as I would believe some sleeping hygiene. For example, do you have kids at your home?
Yeah, of course. I have 5 kids. So
Oh, gosh.
They are just making noise a lot for me as well with my grandmother.
So let me just confirm with that with you. Is that a single story house or double story house?
It's single house.
Okay, fine. And you mentioned that your duty hours are for how long?
12 hours a day.
12 hours.
9 to 9.
9 to 9. Okay. Which time of the day you think it's more calm in the house so that you sleep more? Which time of the day?
In the day, I don't think so because my grandmother is just running every year.
Okay.
Yeah, and
she's a
just-
runner, right?
Yeah, just running to the outside the home, just making
Okay.
noise with my kids,
Mhm.
and I can't sleep. I don't know.
To you, perhaps this is something a big problem.
Yeah.
But being here as a doctor, listening to so many patients a day, I do not consider this problem to be a very big problem, so that you take the highest or high potency sleeping pills for now. I would recommend you to go for the other options we have, stress management options we have. Our counselors can better guide you on that, sir. For example, I mentioned you already, maybe self-caring, maybe sleeping hygiene, or maybe a psychologist can better recommend you. In our hospital, we have one psychologist who can better guide you that how can you take care of yourself than taking sleeping pills. You know, taking artificial sleep would give you no good. Once you will be waking up again, you would feel more maybe nauseous, or maybe that you feel like that you have not slept, etc., because your brain would be forced to be slept for longer, which would not be a good idea. Besides, it has so many side effects. For example, it can disturb your lungs somehow, or maybe your stomach quite often. I don't recommend you for that for now, sir. Please pardon me for this. I am not writing sleeping pills for you, but I can assure one thing, that if you take our psychologist's guidance, he would be the right person to go with you very well. What do you say?
So you're recommending me to the psychologist?
Don't take it negative, sir. We are educated people now, okay? The psychologists are no more negative people. They better understand the human psyche, as well as if someone is in stress, so they are the best people to go to. Let me say it again, that what did we spoke, so that you can better, judge that what should we do. First of all, you're in trouble because of your grandmother, as well as you have 5 children you mentioned, and the workload. It's a common thing, sir, and it's a time passing thing. Let it go in its own manner. Meanwhile, let's start learning to stay with such kind of regular things, then making sleeping pills a regular habit, and then you can become accustomed to that. Even your grandmother goes away, and you would be on sleeping pills throughout, which would disturb your body the whole.
Okay.
So, in my opinion, I'm referring you to a psychologist for now. His name is Mr. A.O., and you have to just meet him 9 a.m. tomorrow, and then he would be doing proper apparatuses and proper counseling with you.
Thank you.
Thank you for your time,
Okay.
dear Munir. We'll see you around, inshallah.
Inshallah.
God bless you. Thank you.
Thank you.
Thank you, G. Thank you for hearing. Well, if you are a doctor yourself, pardon me if I could not give some good technical terms. But what we were trying, or I was trying to be more fluent in my talk throughout, as well as the content which I had to take. I had been talking about all the role plays elements we had, as well as we were quite coherent while talking, which that's what you require. And if you're appearing in your OET, PTE, IELTS, or TOEFL, IE8 Islamabad is the place you can visit to at Gateway Study Links. And I guess Dr. Munir would also recommend Gateway.
Yeah,
to
of
the
course,
audience.
I highly recommend this.
Glad to hear. You'll
Yeah.
get your commission, okay?
Inshallah.
Thank you very much, guys. See you again, inshallah. Bye bye.